Have you ever looked at your pet and thought, something's a bit off? Maybe they're not quite as energetic, or perhaps you catch a little yellow tinge in their eyes.
Yeah, that subtle yellowing. It can show up in the gums or even the skin sometimes.
Exactly. And that's what we're really zeroing in on today.
We're doing a deep dive into jaundice in dogs and cats. The medical term is icterus, but it all means that same yellow discoloration.
Right. And the key player here is a substance called bilirubin. Jaundice basically means there's too much bilirubin floating around, causing that yellow color. So today, using canine and feline jaundice as our guide, we want to figure out why this happens. We'll explore the different ways it shows up, what clues you should look for, and crucially, why it's always a sign to take seriously.
That's the main point, really. Jaundice itself isn't the disease. It's more like a warning light. Something else is going on under the hood.
Okay.
And to really understand it, we need to look at how bilirubin builds up. We generally break it down into three main types: pre-hepatic, hepatic, and post-hepatic jaundice.
And figuring out which category it falls into is key, right?
Absolutely. It helps vets narrow down the cause.
Okay, so let's start with bilirubin itself. Where does it even come from?
Well, it's a natural breakdown product. Most of it, maybe 80%, comes from old red blood cells being recycled by the body.
Okay, that makes sense. Old cells getting broken down.
But, and this is kind of interesting, the other 20% or so actually comes from breaking down other proteins that contain heme. Things like cytochrome P450 enzymes, which help metabolize drugs, and myoglobin in muscles.
Oh, interesting. So not just blood cells.
Yeah.
Okay, so bilirubin's produced. What happens next? Where does it go?
So initially, this bilirubin is what we call unconjugated. It doesn't dissolve well in water.
Right.
So to travel through the bloodstream, it latches onto a protein called albumin. Think of it like a taxi service.
Okay, gets a ride.
Exactly. It rides the albumin taxi to the liver. Once it gets there, liver cells grab it and perform a process called conjugation.
Conjugation.
Yeah, they attach glucuronic acid to it. This makes it water-soluble. Now we call it conjugated bilirubin.
Got it. So the liver modifies it, makes it soluble. Then what?
Then this conjugated bilirubin gets actively transported into the bile. Bile is crucial for digestion, as you know. This bile, now carrying the bilirubin, flows into the intestines.
Okay.
In the intestines, gut bacteria get to work on it. They convert most of it into other substances, mainly urobilinogen.
Urobilinogen.
Yeah. Some of that can actually get reabsorbed back into the bloodstream and go back to the liver. That's called enterohepatic circulation, like a little recycling loop.
Oh, okay.
But the rest, mostly converted into something called stercobilin, gets passed out in the feces.
Purcobilin. Wait, is that?
That's the stuff that gives feces their normal brown color. Exactly.
Okay, that connects the dots. So if something goes wrong anywhere in that whole process,
then you can end up with too much bilirubin in the blood. And that's what we call hyperbilirubinemia.
Hypobilirubinemia, got it. Too much bilirubin.
Precisely. And like we said, this excess happens for one of three main reasons, which ties back to our jaundice types. Either too much is being made.
Pre-hepatic.
Right. Or the liver isn't processing it properly.
Hepatic.
Yep. Or it's processed, but it can't get out of the body.
Post-hepatic.
Yeah.
Blockage. Okay. Let's tackle the first one then. Pre-hepatic jaundice. What's the core issue there?
Pre-hepatic is all about overproduction. The body is making bilirubin faster than the liver can clear it.
And what causes that overproduction?
The main driver is increased destruction of red blood cells. The medical term is hemolysis.
Hemolysis, so red cells breaking down too fast.
Exactly. If red cells are being destroyed rapidly, the liver just gets overwhelmed by all the bilirubin released.
So what might an owner see early on? What kind of signs point towards this hemolysis?
Well, often the initial signs are pretty vague, unfortunately. Things like lethargy, just seeming tired or weak. Maybe some GI upset, like not eating well, vomiting, maybe some weight loss over time. And then, of course, the jaundice itself appears.
Okay. Anything in the pet's history that might be a clue?
Definitely. You'd want to know about any recent blood transfusions or maybe significant trauma that could cause internal bleeding. Less commonly, severe muscle breakdown, rhabdomyolysis, can also contribute.
Right. So lethargy, maybe some GI signs, plus that history.
Yeah. Being aware of those subtle changes is key, especially if there's any chance of, say, toxin exposure or if the pet has a known immune condition. Because rapid hemolysis needs quick attention.
And if a vet examines a pet with suspected pre-hepatic jaundice, what might they find?
Okay, so on exam, they might see pale gums, pallor because of the anemia from red cell loss.
Makes sense.
You might find a fast heart rate, rapid breathing, general weakness. Sometimes, interestingly, the pulses might feel quite strong despite the anemia.
Huh.
An anemic heart murmur is possible, obviously the yellow jaundice. The liver or spleen might be enlarged because they're working overtime dealing with the cell breakdown. Lymph nodes could be enlarged too. If the platelet count is also low, which can happen with some causes, you might see signs of bleeding.
Wow, okay.
Sometimes the feces might even look orange. Fever can occur. And in some specific situations involving blood vessel damage, the skin might feel kind of gelatinous. That's less common, though.
A lot of potential findings. So
Yeah.
what are the actual underlying causes? What triggers this kind of hemolysis?
Oh, there's quite a list. A big one is immune-mediated hemolytic anemia, or IMHA. That's where the immune system attacks its own red cells.
Yeah.
Seems more common in adult female purebred dogs for some reason.
Okay. IMHA. What else?
Certain drugs can do it. Propylene glycol in cats, sometimes trimethoprim sulfa antibiotics,
Right.
autoimmune diseases like lupus. Infections are a big category too, things like feline leukemia virus, certain blood parasites like mycoplasma, heartworm disease, Babesia, Ehrlichia, Cytoxine.
So lots of infectious agents.
Yeah. Then you have toxin zinc, like from swallowing pennies, onions, certain phenols. Very low phosphate levels in the blood. Severe hypophosphatemia can cause it. Getting the wrong blood type in a transfusion, obviously, and large internal bleeds like a big bruise or bleeding into the chest or abdomen, maybe from trauma or a bleeding tumor like hemangiosarcoma, or even rat poison. The body reabsorbs that pooled blood and it can overwhelm the system.
Okay, so basically anything that damages or destroys red blood cells really fast can lead to this pre-hepatic picture.
That's the essence of it. Too much breakdown product.
Right. Let's move to the liver then. Hepatic jaundice. What's gone wrong here?
With hepatic jaundice, the liver itself is the problem. It's failing at one of its bilirubin jobs.
Which jobs?
It could be struggling to take up the unconjugated bilirubin from the blood, or it can't conjugate it properly to make it water-soluble, or it can't effectively secrete the conjugated bilirubin into the bile.
So the production might be normal, but the liver's processing plant is malfunctioning.
Exactly. The liver is just not keeping up its end of the bargain for various reasons.
What kind of signs might point towards a liver issue? What would the owner notice?
Again, you often see those non-specific GI signs, poor appetite, vomiting.
One thing that might be different here is the feces color. If bile is still being made but maybe not flowing perfectly, the feces might look greenish or orange rather than pale. Jaundice, of course. The urine might look dark orange. If fluid builds up in the belly because the liver isn't making enough protein or pressure changes, you might see abdominal distension.
Okay.
Sometimes increased thirst and urination. And if the liver damage is really severe, it can affect the brain, leading to changes in behavior or mental state. That's hepatic encephalopathy.
Right. And what would the vet find on physical exam?
Weight loss is common with chronic liver disease. Jaundice, naturally. The liver might feel enlarged or sometimes small and firm if it's cirrhotic. The spleen could be enlarged too.
Okay.
Abdominal fluid might be detectable. Palpating the abdomen might reveal pain or even a mass. Feces could be dark and terry-melina if there's bleeding higher up, or, like we said, orange-green or maybe pale. Fever is also possible.
So what specific diseases cause this kind of liver malfunction leading to jaundice? It's a really wide range. There's chronic hepatitis, which can be idiopathic, meaning we don't know the cause, or sometimes familial in certain breeds.
Which breeds?
Well, breeds like Labs, Dobermans, Bedlington Terriers, Cockers, Dalmatians seem to have a higher risk for certain liver conditions. It's quite fascinating.
Yeah, that is. Okay, what else?
Adverse drug reactions are a big one. Things like certain anti-seizure meds, acetaminophen, very toxic to cats, especially trimethoprim sulfa again, some NSAIDs like carprofen, and even drugs like stanozolol or benzodiazepines in cats.
Right, drug toxicity.
And you have inflammation like cholangitis, which is inflammation of the bile ducts, or cholangiohepatitis involving liver tissue too. Cancer that infiltrates the liver like lymphoma. Cirrhosis, which is end-stage scarring, more common in dogs. Hepatic lipidosis, fatty liver disease is a huge one, especially in cats that stop eating, particularly if they were overweight to begin with.
Ah, yes, the anorexic fat cat scenario. Very important.
Absolutely. Then there's massive liver necrosis, where large parts of the liver die off suddenly. This can be caused by toxins like aflatoxin from moldy food, certain plants like cycads, some NSAIDs, or copper accumulation in susceptible braids.
Wow, severe.
And systemic illnesses can affect the liver too. Things like leptospirosis in dogs, fungal infections like histoplasmosis, FIP in cats, even hyperthyroidism or toxoplasmosis in cats can have liver involvement.
Okay.
And finally, even severe bacterial infections elsewhere in the body, sepsis, can interfere with the liver's ability to handle bilirubin.
That's a staggering number of potential liver problems.
Yeah.
Okay, third category, post-hepatic jaundice. What's the issue here?
Post-hepatic means after the liver, so the liver has done its job, conjugated the bilirubin, put it in the bile, but the bile can't get out. There's a blockage somewhere in the bile ducts.
A plumbing problem, essentially.
Exactly. The pipes are blocked, so the bile, full of bilirubin, backs up into the bloodstream.
What signs might suggest this kind of blockage?
Again, those vague GI signs might be present, but the really classic sign, if the blockage is complete, is alcoholic feces.
Alcoholic.
Meaning pale, clay-colored stools. Because no bilirubin is reaching the intestines to be turned into stercobilin, the pigment that makes poop brown.
Okay, that makes sense. No pigment getting through.
Right. You'll also see jaundice, likely orange urine, and possibly abdominal enlargement if fluid backs up or there's inflammation.
And on the vet's exam.
Jaundice, of course. Liver might be enlarged because bile is backing up into it. Spleen maybe too, could feel fluid, maybe a mass, or find pain when pressing on the abdomen. And definitely looking for those pale feces.
What kinds of things actually cause these blockages?
Several possibilities. Pancreatitis, inflammation of the pancreas, is a common one. The swollen pancreas can squeeze the bile duct shut, sometimes just temporarily.
Okay.
Cancer is another cause, cancer of the bile duct itself. The pancreas or the nearby small intestine, the duodenum, can obstruct flow.
Right, tumors.
Things inside the duct can block it too. Gallstones, though less common than in people. Thick, sludgy bile. Liver flukes, particularly in cats in some areas. There's also an immune condition in cats that causes inflammation and scarring of the ducts. And in dogs, something called a gallbladder mucocele is quite important. The gallbladder fills up with thick mucus, blocking outflow. Certain breeds are predisposed to this too.
Another breed thing to watch for.
Yep. And finally, though maybe not a classic blockage, if the bile duct or gallbladder actually ruptures, bile leaks into the abdomen. That causes severe inflammation and jaundice because the bilirubin isn't being excreted properly.
So a physical obstruction is the key theme for post-hepatic.
Exactly. Something stopping the flow.
So we have these three categories. If a pet comes in looking yellow, how does the vet work out which one it is? What's the diagnostic plan?
That's the million-dollar question, isn't it? It starts with the history and physical exam clues we've been talking about. How fast did the jaundice come on? Are the gums pale or just yellow? Is the liver big or small? Is there abdominal pain or fluid?
Right, putting the initial pieces together.
Then lab tests are absolutely crucial. A bilirubin test confirms hyperbilirubinemia and sometimes measures the conjugated portion. A CBC complete blood count is vital. Looking for anemia, signs of red cell damage or regeneration, checking platelet numbers, white blood cell counts for inflammation or infection.
Oh, TBC. What else?
Serum biochemistry panel. This looks at liver enzymes like ALT and ALP, which can be elevated with liver damage or bile backup. It also checks liver function markers like albumin, BUN, glucose, cholesterol.
And urine.
Urinalysis is very important. Finding bilirubin in the urine bilirubinuria, especially in cats, where it's almost always significant, can be an early sign, sometimes showing up even before the jaundice is obvious to the eye.
Good tip. Okay, so baseline bloods and urine. What if those aren't definitive? What other tests might be needed?
Depends on what the initial tests suggest. If hemolysis, the pre-hepatic type, is suspected, maybe a saline agglutination test or a Coombs test to check for immune attack on red cells. Looking closely at a blood smear for abnormally shaped red cells or blood parasites. Maybe checking zinc levels if toxin ingestion is suspected. An ANA test for lupus.
Right.
If it looks more like the liver or blockage issue, maybe serum bile acids testing to assess liver function more directly. Serology for infectious diseases like lepto or LV. If there's fluid in the abdomen, taking a sample to analyze the cells and protein can be very helpful.
Abdominal fluid analysis, okay.
And coagulation testing, checking blood clotting times is important, especially with suspected bile duct obstruction, because vitamin K absorption needs bile flow.
Ah, good point. And imaging, x-rays, ultrasound.
Yes, imaging is key. X-rays give a general view, check organ size, look
Yeah.
for masses, maybe mineral deposits or gas in the liver region, check lymph nodes.
Mm.
But abdominal ultrasound is often the star player here. It's excellent for looking at the liver texture, the gallbladder, the bile ducts. It can really help distinguish between diffuse liver disease versus a blockage.
So ultrasound is really helpful for differentiating hepatic versus post-hepatic?
Hugely helpful. Plus, it can identify masses, assess fluid, and guide sampling procedures like fine needle aspirates or biopsies if needed.
Right, sampling, biopsies and aspirates to get actual cells.
Exactly. Sometimes fine needle aspiration gives enough info. Other times, a larger biopsy sample, maybe taken surgically or via laparoscopy, is needed for a definitive diagnosis, especially for liver diseases. And sometimes surgery is needed anyway for post-hepatic problems, like removing a gallbladder mucocele or bypassing an obstruction.
Okay, quite a diagnostic pathway. So once you have a diagnosis, or at least know the category, what's the general approach to treatment?
Well, the absolute #1 rule is treat the underlying cause. Jaundice is the sign, not the disease itself.
Right, treat the cause.
Often, pets need to be hospitalized initially for supportive care, fluids, monitoring. Cage rest is usually advised, either to help the liver heal or, if severely anemic, to reduce oxygen demand.
Okay, what about diet?
Diet's important. Needs to be balanced. Good quality protein. If there's concern about hepatic encephalopathy, that brain effect from liver failure, sometimes a lower protein, higher carbohydrate diet is used, especially in dogs. Sodium restriction if there's fluid buildup.
And vitamins, you mentioned vitamin K.
Yes, water-soluble vitamins are often supplemented because the liver stores many of them. And injectable vitamin K1 is crucial if there's bile duct obstruction because vitamin K isn't absorbed properly without bile.
Okay. And medications, how do they differ for the types?
For pre-hepatic, you target the cause of hemolysis, maybe immunosuppressants for IMHA, antibiotics for infections, removing the toxin, blood transfusions if the anemia is life-threatening.
Right.
For hepatic and post-hepatic, it really depends on the specific diagnosis from those tests and biopsies. Could be antibiotics for infection, anti-inflammatories, specific treatments for copper storage disease, surgery for blockages. It's very tailored.
And are there drugs to be careful with when a pet has jaundice?
Definitely. You have to be cautious with any drug primarily metabolized by the liver, as its function might be compromised. Certain drugs are known to be potentially hepatotoxic and should generally be avoided, like tetracyclines, maybe certain pain meds or anesthetics if liver failure is severe.
Makes sense.
Sedatives need care as they can worsen hepatic encephalopathy. Corticosteroids have a role in some non-infectious inflammatory conditions, but they also carry risks like increasing infection susceptibility or fluid retention.
So drug choices need careful consideration.
Absolutely. And doses might need adjusting because of that altered liver metabolism. Ongoing monitoring with repeat blood tests is usually essential to see how the pet is responding and if treatment needs tweaking.
This has been incredibly informative. It really helps clarify what jaundice means. So wrapping up, what's the main message you want listeners to take away?
I think the biggest takeaway is that jaundice, that yellow color, is never normal. It's always a sign of an underlying problem. And understanding whether it's likely pre-hepatic, hepatic, or post-hepatic based on the clues we discussed gives vets a huge head start in figuring out what that problem is.
Yeah, absolutely. So if you see any yellowing in your pet's eyes, gums, or skin, don't wait. It warrants a vet visit to investigate the cause and get the right treatment started. And it was fascinating to learn bilirubin doesn't just come from blood cells, but also those drug-metabolizing proteins.
It is interesting, isn't it? And thinking about that, here's something to ponder. Considering the huge range of possible causes we've talked about, from infections and toxins to immune problems and blockages, what does jaundice really tell us about how incredibly interconnected all the body's systems truly are?
It's a great point. How something seemingly simple like color change can point to complex issues involving the blood, the liver, the immune system, digestion, all linked together. Definitely something to think about.